And welcome back to the Steve Malzberg Show, ladies and gentlemen. Monday edition, of course. And our first guest of the day and of the week is Stephanie Kirchgaessner. And she has written a wonderful piece, a very informative piece. It was leading drudge yesterday for most of the day. The new Affordable Care U.S. health plans will exclude top hospitals, which means if you need a Sloan Kettering or one of the top Mayo Clinic or Cleveland Clinic or one of those, there's a chance that if you take Obamacare, you're not going to get into those hospitals with that insurance, and that's really a problem. So let's welcome in Stephanie. How are you?
Great. Thanks for having me on the show.
Well, yeah, go ahead.
Well, so in some of these states, it's not in all states, but in some of these states, your choices are definitely limited. So there's a chance you could have Sloan Kettering in the plan that you buy, but it's definitely not guaranteed, and it's in fewer plans than it is included in the plan. So it's more likely, for example, in New York State, on the individual market, only 2 of 9 plans that are being offered in New York State include Sloan Kettering.
Only 2? Yeah, go ahead.
Yes, which is, of course, a major cancer center that's world-renowned.
Of course, absolutely, and it's the first thing people think of. God forbid if they need something like that. And by the way, we should mention, of course, that your piece appearing in the Financial Times. You're the D.C. correspondent for the Financial Times. What else? I mean, 2 out of 9. That's not good odds. Is this another one of those deals that is now shocking people that nobody knew about, or they knew and didn't and elected not to tell us?
Well, I think what's going to happen, Steve, is that people are not yet aware of this because it's actually, as anyone who's dealt with health insurance in the past knows, it isn't sometimes that easy to find out which hospitals and which doctors are in network and which aren't. And certainly I think there might be some surprises in store for people. But this is really the situation we're looking at. This is not going to be the case for people who have always had the same insurance and who have employer insurance, which is the vast majority of Americans. So we are talking about a narrow slice of the population, to be clear, who are involved in the individual market and who are now buying plans through the Obamacare website. Now, for a lot of these people, it's going to be their first shot at insurance ever, so you could argue, well, something's better than nothing. But there are other people, millions of other people, whose plans are being canceled, and we've, probably are well aware of that story, and I'm sure your listeners are. And they may have more narrow options as a result of some changes than they were perhaps used to under their old plans.
Absolutely. And, in your piece, you quote a gentleman from Cedars-Sinai in Los Angeles, and he talks about how the hospitals that are being excluded are leaders in not only care, but in innovation, and it saves billions of dollars for the healthcare system in the long run, and people are going to be shut out of these hospitals, so it's going to hurt them. It's going to hurt the whole system in the long run.
Yeah, certainly this is not good news for patients who want as many options as possible, which is really what all of us want for ourselves and for our families. But maybe we can talk a little bit about why this is happening. This is not in the law that these networks should not be included. The reason it's happening is because we're seeing a huge transformation in our healthcare system, and there are rules that are now there to protect people, but for example, people who have previous medical conditions can't be excluded anymore, and other items have to be covered, like maternity care, where people could be kept from having insurance in the past if they wanted maternity care. But it comes at a price, and we're still learning what that price is.
And that price is going to affect lots and lots of people. When it probably would have been, I guess, more beneficial for everybody if they would have figured out a way to help those people with pre-existing conditions and who didn't have access to certain care, as opposed to penalizing everybody. For instance, you talk about maternity care. As you well know, I have to get maternity care if I have to change policies, and I certainly don't want it and don't need it. We'll never use it, but I'm going to be paying for everybody else's maternity care who will use it.
Well, that's one of the new facts of life. But the question is, do we want to have people being excluded because they don't get maternity care? So these are the questions that we're now grappling with. And in this case, insurance companies are deciding not to include certain hospitals that they think are very, very expensive, where they think you can get treatment that's more efficient in other hospitals. Now, the question is that really correct? Are some of these hospitals really inefficient, or are they just offering top-notch care? What are really the real differences in outcomes? Now, I'm not saying that I have answers to these questions, but I think these are the things that we have to start talking about.
We're talking
because some people say, actually the difference in outcomes, just because you go to a fancy hospital that everyone's heard of versus a local hospital that people haven't heard of, then perhaps it's not such a big difference.
Well,
and certainly there's maybe not a difference if you're getting your tonsils removed.
Right, but if you have cancer, I'd like, if that's what the HHS says, I'd like to have them send all their people to a local hospital in the sticks somewhere, as opposed to having access to the specialty hospitals. And the American Health Insurance Plan's spokesperson, for instance, says that this new plan is going to impose all kinds of new costs to the industry, and so they have to act accordingly. So they're claiming that they're being saddled with costs, and then that's why they're doing what they're doing by excluding these hospitals. And in the long run, it's going to be the patients that are going to suffer.
Yes, I think that's true. And I think when I was doing my reporting for this piece, I had a real spectrum of reactions from the hospital administrators I was talking to. Some were definitely concerned, and even the Mayo Clinic, which I'm sure your listeners have heard of, they, in Minnesota, in the Rochester region where Mayo Clinic is located, they initially, when Minnesota initially came out with its plans, the state regulators actually got involved because Mayo was not very widely accessible, and neither were other hospitals.
It was very limited. Yeah. All right. Listen, Stephanie, this is something we're going to have to keep up to date on. Thank you very, very much. That's Stephanie Kirchgaessner, Washington, D.C. correspondent for the Financial Times. Thanks for joining us.
Thanks so much.
My pleasure. All right, folks, we're coming back. Susan Venker, founder of Women for Men. Women need husbands, she says. Steve Malzberg Show, Newsmax TV.